Tim Barry. I'm the Director of Public Affairs for the Society, and I'm very excited today to be joined by Jennifer Rose from the Virginia Department of Labor and Industry. Jennifer is going to help us sort out the new impacts of the Department of Labor's new emergency temporary standards related to COVID-19. These standards are designed to keep Virginians safe and healthy at work, customers confident in the safety of Virginia's business establishment, and employers open for business. We already know that these are the first of the kind regulations in the country, and we know they come at a time of news overload and intense churn. So we wanted to spend some time today parsing out how the regulations impact all employers in Virginia and try to see how CPA firms can adapt. So I'm just going to jump right in. Jennifer, thanks again for joining us. I think one of the first questions we're hearing a lot from our members is, if a firm is already complying with the CDC guidelines, how do they fit these regulations in within those guidelines?
The emergency temporary standard does have an allowance for employers to follow CDC guidelines, and basically, as long as it's at least as effective as the standards, then compliance would be sufficient. Basically, if asked, the employer would need to be able to provide that specific CDC guideline that they're following.
Got it. And we've seen a lot about the different risk levels that are put in place as part of the regulations. Can you walk us through those different risk levels a little bit and tell us about how the job changes might affect the risk level of a particular position?
Sure. There are 4 different exposure risk levels that are based on the job tasks that employees would do and determining what hazards they are exposed to as related to COVID-19. The most serious is the very high exposure risk level, and we see this typically in specialized medical fields where they're doing certain medical procedures that would make the virus aerosol, things like intubation and certain testing and lab procedures. So it's not very, very common, but it still is out there in the workforce. The next level is the very high level. And this we typically see in the medical field, where employees are working within 6 feet of those known to be positive for having COVID. And then there's the medium exposure risk level. And this is where we see typically public interaction, basically with employers that are likely to have more than 6 feet of distance or closeness with employees, other employees, the public, contractors, things like that. And then there are the lower risk categories, and these are employers that can limit their exposure to other employees or those known or even not known to be suspected of having COVID-19. And this is where you could have employees that engineering or administrative controls have been applied so that they do not have that exposure other than just incidental.
Great. Some of the firms that have reached out to us are CPA firms with specific questions and concerns about their staff that are in cubicle spaces rather than personal offices, and just how they should be protective of those folks that are open. And should staff working in cubicles be expected to wear masks while they're at their desks if they're distant?
Typically what we're telling employees in office type settings like that is that masks should be provided. However, they can be limited to use where, like, they're outside of the cubicles, walking around the halls, and in any common areas, things like that. But basically, just the biggest thing is informing employees of that hazard so that they are able to maintain that 6 foot distance. You don't have another employee coming into that employee's workplace, work area in the cubicle. So just being mindful of those things.
So I'm hearing that as long as someone's at their cubicle in their own space and there's no one else in there with them, and they're able to maintain that distance, that they're able to take that face covering off while they're at their workstation?
Yes.
And does the cube wall height play any factor? Is there anything that employers can do to alter or bolster a cubicle work environment to make it more compliant?
Sure. The standard does talk about adding engineering controls such as barriers that would extend basically within that exposure area where you've got employees that are talking, exposing potential other employees to the virus. This would be really, I could think of a situation where you've got the really low, more open concept office areas where you have the cubicles, but they're more just like divisions between certain areas.
Yeah.
But you know, if you got more of the robust and higher division levels between the cubicles, and that would, you know, you're essentially protecting that face-to-face exposure.
Got it. And do employers have any responsibility as far as covering the cost of testing or providing any testing to their employees, pardon me?
Yes, if the employer is going to do that testing in compliance with the standard, they are required to pay for that.
And would the test take place off-site? They don't have to actually administer any testing. They would have to just kind of cover the cost for it off-site?
Correct.
And can you tell me, is there any burden on the employer as far as the contact tracing goes if there is a reported case?
Our standard does not cover contact tracing. That's typically covered by the Department of Health, so there's no requirements in our new temporary standard to do that.
How long do you think that these standards are going to be in place? How long should we expect to be underneath these rules?
Well, the emergency temporary standard is effective for 6 months. It was adopted July 27th, and basically during this 6-month process, the Safety and Health Codes Board is looking at adopting a permanent standard. There will be public notice meetings and potentially board meetings that will be open to the public, that where they could come and find out about, you know, what the discussion is. But yes, there is the potential for having a permanent standard be adopted.
Wow. And can you talk to me a little bit about the disclosure of a positive result? Talk to me a little bit about how an employer would have to notify other employees. How does that match up with HIPAA rules as far as privacy around medical information?
Basically, the simple answer is that as long as the employers are not conveying the identity of the positive case, then it's considered to be in compliance with HIPAA. The regulations do go into that and basically say that, you know, to the extent that you can inform other employees of that positive exposure without identifying the employee that's tested positive.
So can we walk through a scenario where this would happen? You know, let's say one of our member firms that had 50 employees that were all working together in an in-person office setting. They were safely distant, they were complying in every other way, and the employer finds out that there is a positive test amongst those employees. Can you walk me through kind of what the next steps would be after that if the employer does find a positive case?
After the employer is made aware of a positive case, they have 24 hours to inform any of those employees that potentially could have come into contact with that positive person. Obviously, we give the example of working in the same work environment. You know, any interactions potentially that they've had with that positive employer, they'd need to be informed of that.
And does that extend outside the workplace? Do they have to notify any clients they might have interacted with or any vendors?
The standard just is specific to the work site. Ideally, other employers have similar policies in place, but it does talk about, you know, if employees or other contractors, things like that, come into your site, you are required to do that notification. And likewise, the other employer would have that responsibility as well.
Got it. And is there any burden on property owners or building managers if there's multiple different businesses within, you know, under one roof? Is there responsibility to tell other tenants or other folks within one building?
Yes, the building owner does have a responsibility under the standard to inform the tenants when there has been a positive case in the building. Again, they don't have to tell them who the identity of the person, but they do need to make them aware of what floor or what work area that positive case where that employee was working.
Got it. And then that employee, if there is a positive test, what are the restrictions on that employee who has tested positive and notified their employer? What is the quarantine period before they could return to the workplace physically?
Well, that would be dependent upon CDC guidelines or even what the doctor has allowed that. And that's basically what we're saying is that the employers can either do a test-based test-based system to look at the exposures after, returning to work. The employer does have to have a return to work policy in place that includes how they're going to make sure that that employee isn't potentially risking additional employees after the fact.
And are there any standards in place as far as just logging who is coming in and out of a workplace? Should an employer be keeping a good log of each person that enters and exits the building and the time frames they're there in case they do have to go back and do notifications?
That certainly is a good practice, especially like I know when the Department of Health comes in and does that contact tracing, they're gonna want to see that information.
But that isn't part of the standard. That's not a requirement that's laid out right now.
Not specific to writing a detailed list of who was exposed. The standard just requires in general that notification.
Got it. But it sounds like probably a best practice just to keep a log just in case there is an incident.
Exactly.
Great. And where should folks go if they've got additional questions? What's the best source for getting questions answered and just kind of getting up to speed on these guidelines?
The Department of Labor and Industry webpage, we actually have a page dedicated to COVID-19. There, employers can find the text of the standard. We have a whole section on outreach and training material, things like PowerPoints, infographics, and some of the required policies and procedures that are required by the standard. We do have templates available for employers on there. I can send you the link if you want to, but it's pretty self-explanatory. Once you go onto the Department of Labor and Industry webpage, it's there right in the front.
Great. We'll post those links along with when we share this video out to our members later today. What is the most important thing, if you were to say the most important thing for both the employee side and the employer side to know as we all adapt to this new set of regulations?
I think the biggest thing with employees is to make sure that they are being cognizant of those simple things they can do, things like social distancing, washing their hands, wearing any personal protective equipment that the employer may have decided that the employees need to wear.
And that's a good point. We haven't talked about the PPE yet. Can you tell me about any requirements for employers to provide that PPE to either employees or to vendors, guests, clients?
The employers are required to perform a PPE hazard assessment, which basically puts them under the requirements, looking at all the job tasks that their employees are doing and where those potential exposures could be. And from then they would determine what exposure risk level, and that would determine then what personal protective equipment would be required. If it is found that, for example, you have employees in the high exposure risk level where you determine that N95 respirators or surgical masks are required, then you would be required to provide those to the employers, excuse me, to the employees.
And to any visitors that were to come into the space or any customers?
Right, whatever in compliance with your policy that you determine based on the exposure is.
And is there a mechanism for employees to report or to kind of let your office know about any violations, or if they believe that their employer is not in compliance? Is there a way that they can kind of blow the whistle on that?
Sure. As with any violations of any safety standards that employees may experience in their workplace, there is a link on our webpage for reporting complaints. We do have a dedicated email for COVID-19 complaints and questions, and that'll be on the webpage as well.
That's great. We'll provide those links with this video as well. This has answered all of my questions, Jennifer. This has been really helpful to me. Is there anything else that you think that firm managers need to know, employees need to know, any kind of building managers might need to know? Is there any last tips you'd like to leave us with?
Nothing specific to the industry. I'd say, certainly read through the standard, read through the support documentation that we've provided. And, if you have any questions, feel free to contact me.
That's great. Well, thank you so much for taking some time and helping educate our members about these new standards. We certainly appreciate it.
You're welcome. Thank you.